casual.
Yeah,
So
that
welcome
works.
to Hercules Performance and Physical Therapy Podcast. We have Dr. Brittney Hughes here.
Hello.
She's a chiropractor. I'm going to let her just tell us a little bit about you.
What I
Go
do?
for it. Yeah.
Yeah. So basically, like you said, I'm a chiropractor. I focus a lot on not only getting patients out of pain, but making sure that they know that pain isn't what I'm chasing. So just because you come in with a pain signal does not mean that that's exactly what I'm going to treat. I want you to be functioning overall at the highest amount. And I also want you to focus on having health. And health is very important. Just because you don't have pain doesn't mean that you're healthy.
Sure.
So we want to really focus on just getting you better, not only feeling better, but functioning better.
What do you mean by functioning better?
So where you don't have any interferences in the nervous system, where you're not having like GERD after you eat, where you're not having issues going to sleep, where you're not having all these different kind of things that can happen when you have those interferences in the nervous system.
Mm-hmm.
So when we do the adjustments and we clear them, that's when you're functioning at the highest amount that you can be. And that's whenever you're, functioning at the optimal support.
Sure. Have you found patients say to you that they actually are sleeping a little better after some of these adjustments and
100%.
manipulations? Like, give us a proper wording what you would say.
Yeah.
Because
so, for example, here,
Yeah.
I'm not going to use names,
Sure.
but I had this 2-year-old baby come in, and the mother was at her wit's end. She had been to the pediatrician a million times. He's having extreme night terrors, like to the point to where he's waking up 6 to 7 times a night, screaming bloody murder and crying. And so the parents aren't sleeping. His sister, that's a baby newborn, isn't sleeping. He's not sleeping. The whole family's a mess. This has been going on for months. And every single night he has night terrors. So finally, the pediatrician was like, I don't know what else to do.
Sure.
Bring him to a chiropractor. So what I did is I did a full assessment on him. I made sure everything was good. I went all the way back to his birth. Like, I was asking the mother all these questions. Did you use forceps? Did you have a vaginal birth? Did you have a C-section? Really going in depth. Well, once we were done with the history, basically the little boy was terrified of doctors because he's been in and out of doctors since he was born because of the night terrors, the past 6 months. So I sat him down on my table. I grabbed a pad kind of like this right here, and I gave him a pen. I said, draw me something fun. So he's sitting on the table. I said, Mommy, come sit in front of him. So she sits in front of him, and they're drawing, and I get behind him, and I grab my little activator, which is a tool that I use to adjust babies for the most part, and I show it to him. I'm like, look, you see this tool? Isn't it cool? And then I was like, Mom, let me see your hand. So I grabbed Mom's hand, and I adjusted the hand, and then I grabbed his hand, and I did the same thing, so he was fine with it. Then we go, and I start feeling the spine. He's sitting in front of me. I'm feeling, and his C1, which is the first vertebrae in the spine, was severely rotated. So all I did was I grabbed right there. He grabbed my hand because it was painful because it's so badly rotated.
Sure.
And I was like, it's okay. So I grabbed it, put my hand there, adjusted it, and he turned around and looked at me, and he turned around and gave me a hug. This little baby that is terrified of doctors, like absolutely was screaming bloody murder in my waiting room, gave me a hug. And then I went all the way down the spine, adjusted what needed to be adjusted. And then I told her, come back in at the end of the week. I want to see how he responded. I know he's going to respond well, but I just want to hear it from you to make sure. She comes back in 3 days later. She gave me a hug. He hasn't had a night terror since.
Awesome.
He slept throughout the night. And it was something that simple, just a rotation of the atlas and getting that fixed. It makes a huge difference. So that it happens in babies, it happens in adults. So it's the same thing. We have the same amount of vertebrae, whether we're a newborn, whether we're 82 years old.
Yeah.
So
bone is there.
Exactly. Yeah. We don't grow new bone over age.
I think that's a testament to looking outside what the traditional idea of is like, okay, I have night terrors, right? I need to go see a doc. I need to go see all this. And those are definitely part of the plan of care, right? But using these other sources that are research, they're based, and they're repeatable, it's happening, like seek them out. That's really cool, right?
Yeah.
And where all you need to do, right, is have you in
Adjust
15 minutes or so and walk out, no night terrors. That's awesome.
It was crazy. Like I would think like, maybe he might have one or no, not one since. And I mean, it just makes a huge deal. My biggest thing is the way I look at healthcare nowadays, which I learned this when I went to a seminar up in Colorado not too long ago. We no longer have a healthcare system. We have a sick care system.
Absolutely.
So you go to the hospital for something small, like let's say high blood pressure. Guess what? They put you on high blood pressure meds. Why do you have high blood pressure? They don't know. I'm just going to put you on meds. Then guess what? There's a side effect to that med. So now you're on another one. Then you're on another one. Then you're on another one. And it's just a downhaul, fall.
Yeah.
And so we no longer have a healthcare system. Our healthcare system is our alternative medicine, physical therapy, chiropractic, massage therapy, acupuncture. That's your healthcare. What do? We look at the root cause of what's going on. Why do you have high blood pressure? Oh, the segment that innervation to your heart is out. Let me adjust that. Guess what? Your blood pressure goes down. It's simple. I mean, it's science. It's there. It's evidence-based. It's just a matter of getting that knowledge out there to where people know that there's an alternative to medicine. And the alternative is healthcare, not sick care.
Sure. I mean, just when you even look at what some of the gyms are doing these days and like advocating for like, look, this stuff exists where, yeah, you have high blood pressure and all this, like exercise, that kind of stuff, the alternative medicine, like that is how we will correct and create a healthcare system, as you say, right? Instead of a sick care. And there's a lot of dominoes that need to fall first, but it's starting, right? You can even notice in a small area like Vero here that may be a little bit more traditional and whatnot. Like there are plenty of alternative providers that are adding some really cool stuff to the area.
I mean, my favorite is the fact that when people come in and they're like, I've tried everything. And I'm like, good, I'm glad you did. I'm glad you did, because now guess what? I'm your last hope and I'm going to get you better. And then you're going to regret trying everything else. Like that's just the main thing. And diet is huge. As you know, like 90% of weight loss is diet. So people are eating like crap and they get high cholesterol and you're like, they go take a medicine for it. And I'm like, that is defeating the whole purpose of this.
Like, not fixing the root cause at all.
Exactly. The root cause is what you really need to focus on.
Sure. And oftentimes, in a lot of cases, it takes longer than people want, right? But there are ways like what you do, some of the stuff that I do, where you can kind of break the cycle a little quicker. And then that'll allow you to do the big things you need, like diet, nutrition, right? Are you sleeping? Like, can you sleep, right? And if it's something where you can't, like that story you told earlier, right? That's huge.
Yeah, it's a huge difference. And I mean, something that small can make a huge change in your life.
Absolutely.
So, I mean, we're not always chasing pain. It can be something that's not pain related. It can be, you know, like I said, neuropathy issues. It can be cholesterol, high blood pressure. That's not necessarily painful.
Sure.
Does it make you an unhealthy person? Correct.
Yeah.
So we want you to function correctly. We want you to be at optimal health. And so just because you're not in pain doesn't mean you don't need to see a chiropractor. Like I have patients all the time when they come in, I'm like, how are you feeling? And they're like, oh, well, I wouldn't be here if I was feeling better. And I'm like, well, no, that's not the case. Like chiropractic was originally made to be a like alternative. It's supposed to be preventative health.
Yeah.
So we're supposed to prevent you from getting sick, prevent you from having these issues. Now it's kind of changed to being pain source. So you have pain, you go to a chiropractor. No, that shouldn't be that. It's like when you drive your car, right? So you get a brand new car. You drive it 6,000 miles. You don't just keep driving it until it breaks and then take it to the mechanic. You go get an oil change. You get your tires rotated. You do maintenance on your car to keep it from breaking. Why do we treat our cars so well, but our bodies so bad? So we don't do these maintenance, these checkups on our body when this is the only one you have. You can crash your car and go get another one. This is all that you have. You're gone, you're gone. And so why don't we do maintenance on our bodies? Instead, we do maintenance on our vehicles. We treasure those so much. And then we only check on us whenever we're in pain, which pain is very subjective, obviously. And it's also very strange in the sense that it's the last thing that comes with an injury and the first thing that leaves. So with that being said, a repetitive trauma injury, so say you work at a desk all day and you're constantly hunched over and you're using your mouse way out here, and then you end up with shoulder pain and neck pain and back pain. That didn't come the first day you started your job. That came 6 years after.
Absolutely.
So it's the last thing that comes with an injury, but it's also the first thing that leaves. So just because you're not in pain doesn't mean that you're better. You're still unstable because you have pain. That's the first sign of instability. So with that being said, just because the pain's gone doesn't mean that you're stabilized. So once the pain is gone, you move on to the next step, which is stabilization, which is where PT comes into play, where we work on your biomechanics. So instead of sitting like this and working like this, you're sitting like this and working with your wrist cocked up. So that makes a huge difference. So biomechanics, physical therapy, massage, acupuncture, chiropractic, it's all hand in hand.
Absolutely. And it's a synergistic thing, right? There's certain things that you guys do, right? That you look at it from a slightly different angle, but I believe the way to really move the healthcare system forward is, right, you need all these different angles that create this like big pie, right? And that creates the whole healthcare model in a sense.
It sure does.
I wanted to kind of pick on, I use the phrase often lagging indicator for pain, where it really is. It's like the check engine light, but your oil's already down or whatnot. You've already been driving 50,000 miles. You get people, like I had someone the other day who walked in and like, oh, I changed my routine or life up about a year ago, but now I'm having pain. Like, that's not super uncommon. Like, it's hard to put two and two together, but big changes, sometimes they take a while to basically happen into pain, right? And
Exactly.
however, that movement dysfunction, the stuff that you were doing that may have caused it, could have been a long time ago.
Exactly.
Part of your daily
exactly
pattern, right?
That's the biggest thing is I not only ask what were you doing when the injury started, it's what did you do for the last 10 years of your life.
Absolutely.
And I mean, movement is so important, you know, from what you do every
Sure.
single day. So when I see an ex-athlete come into my office and they trained, you know, they trained their body to be able to play, let's just say soccer for 18, 19 years of their life. They go off to college and they have a sedentary lifestyle because they're not playing in college anymore. Then they come to me and they're like, why am I in pain now that I'm not playing anymore? Because you're not moving.
Yeah.
Like you're sitting at a desk all day studying. You're laying in a little bitty cot in your dorm. Like everything adds up. And when you train your body to have that elasticity to play soccer, your knees, your hips, everything, and you stop, you're going to go backwards.
Absolutely.
So you got to keep moving. Movement is so important.
Isn't it funny that you see these injuries and they start like occurring at a higher frequency? You think like 35 to 40, you start seeing people achy and soreness, and they say you hit 30 and like things are breaking down. But when you look at it, like you're way less active. You're not really doing that much harm other than maybe sitting in bad positions or whatever. So why is it that at 25, when you're running around slamming yourself into stuff, right, you're fine, but later, there's an age thing, but could just be that you stop moving, right?
Exactly.
You stop doing what your body was meant to do.
Yep, it's huge. I mean, my first thing when I have like a 75-year-old come into my office, he's like, I can't play golf anymore. And I'm like, well, I'm going to get you back to playing golf.
Sure.
I'm not that person that's going to say, don't play golf anymore. I'm going to say, take a step back for 2 weeks. Let's get you better. Absolutely. And then let's ease back into it because movement is important.
Absolutely.
There's a reason why, you know, these athletes, they're able to keep doing what they're doing because they're moving.
Yeah.
Like you go backwards when you stop. So,
and I think that brings up a really good point in the sense of, even if we have to remove ourselves from the sport for a little while, that does not mean, hey, we're not doing anything, right?
Exactly.
And it could also be, hey, maybe we're not using the driver, right? Something with a long axis, basically a lot of torque on the back. Maybe, hey, we're just putting for the next few weeks. But the fact that you're out there moving, there's a pain relief effect just to exercise, that like high you get in the middle of a workout. That's your body's way of being pumping. That's your body's way of saying, we like this, keep doing this for some reason, right?
Yep. I mean, there's such thing as a good sore.
Yes,
you know what I mean? Like
absolutely.
After a good workout, you want to be sore, and that's a good sore. You feel great when you're. I mean, it sucks going upstairs, but it's a great sore. You know what I mean? Like
I thought I was the only weirdo that like the soreness up the stairs. That like little bit of quad soreness after a workout.
I'm like, oh yeah,
that's
good. Yeah.
There's definitely the kind where you're like, I can't stand up. And it's too much, but it's rare.
Yeah, that good sore. That's what you want.
Yes, absolutely. I got them in the calves right now from the Dubs.
Yeah, exactly.
Brittney, give me a couple just like fun little, I'm going to ask you some fun little tidbits about chiropractic. So one I often get is what happens with a pop or crack that you may get.
Yeah, so that popping, cracking sound, you know, I can take all these scientific words and put it into it, but I'm just going to be simple. It's a gas release.
Okay.
So you hear that?
Yep.
That's a release of gas. So what the adjustment does is it kind of opens up the synovial fluid. And when it does that, if there's any gas in there, it releases.
Sure.
So a lot of times, if you get an adjustment and you don't hear a pop, doesn't mean it didn't move. It just means that you didn't have any gas built up. So the gas builds up whenever you have two segments that are kind of like this.
Okay.
When one turns and it's stuck, gas forms in the synovial fluid. So when we adjust it back, that gas releases and it makes that pop. I mean, yeah, don't get me wrong. I love the sound of that. Like I am a definitely crack addict. Yeah. But when it comes to making the sound versus getting the thing to move, I focus more on getting movement. But I do love the sound.
Yeah, the sound is good. It just gives you that little bit of feedback. Like,
sure
you got it.
Yes, exactly.
Even though we know that's not necessarily what's going on, it's just a good correlate there.
I like it. It's one of those things, you know, you just get some thrill out of it.
Yeah.
Because the patients hear it, they feel better. You know. It's a great audible response.
There's a phrase that my family always said growing up when we were playing sports: "Look good, play good." It's kind of sound good, play good, whatever it is.
Just like that.
So let's say you get that pop, you don't get the pop, you get adjusted, manipulated. What is kind of course for action after that? What would you say are best practices?
So I have 3 steps to recovery. Cool. First step is get you out of pain. So I don't chase pain, but if you're in pain, I'm going to try to decrease it. So let's get you out of pain. Second phase is let's stabilize that instability that you got going on. The fact that there's pain there means that you're unstable. You wouldn't have pain if you were completely stabilized. So the fact that you have pain means you're unstable. So second step is stabilize. Stabilize is where you come into play. That's where you do functional strengthening. That's where you do biomechanic training. We give you small exercises to do at home, all these little things. And after stabilization, it's pretty much maintenance. Every once in a while, get your car oil changed, basically. And so that's kind of the 3 steps that I try to go through. My goal isn't to see patients every day for the rest of their life.
Sure.
There's some chiropractors that you walk into their office, the first thing they say is, oh, you have pain? Yeah, that's going to take me about 3 times a week for 4 weeks, 2 times a week for 7 weeks. And next thing you know, you're on a 6-month plan.
Sure.
If it takes you 6 months to get out of pain, get out of that office because you're not in the right one.
Yep.
So basically, you just need to focus on those 3 steps. And every patient's different. Somebody that's active like you, if you were in pain, it might take you 2 adjustments and you're better. Like you're out of pain. Then we work on stabilizing. But if it's somebody that is, 75, they've reached all options they can, they're on pain medicine every single day, they come into my office, it's going to take them a couple weeks.
Yeah.
So you have to structure the three-phase plan to each patient. So when every patient comes into your office, they get the same plan.
Yep.
That's terrible chiropractic care, if you ask me. And all that is money. All they're wanting is money out of your pocket. But my thing is if you focus on getting the patient better, getting them out of pain, stabilizing them, putting them on maintenance to come in every once in a while, they're going to tell other patients.
Oh, absolutely.
Your office is going to be booming, and you're not going to be worried about, do I have to pay the rent? Do I have to do this? You're going to be more focused on patients. And when you start focusing on patients, you see a huge change in your office.
Sure.
Whenever you're giving out those stupid care plans that are 6 months long for every single patient with the exact same weeks, spread out frequency, that's the wrong way to do it.
Sure.
I've seen many chiropractors do that, and it just makes me want to shake my head very hard.
Yeah, and, I think too, the model has kind of changed over the years, right? And there's more hey, you make someone feel better, you make them better, you make them move better, fix their root cause. They're going to come back to you later.
Exactly.
Because active people are going to throw stuff out, right? It's part of life. And if you do a good job and you can get them out and out of that pain quickly, that's only a more testament to how good you are, right?
Exactly.
And
yep.
They'll come back.
Exactly.
They want to work with you. Yeah.
That's my thing. Is I always tell patients when they first come in, I'm like, I'm not that chiropractor that wants to see you every day for the rest of your life. You may be fun. You may be cool. You may make me laugh. We may have a great time in my office, but I want to get you better.
Sure.
That's the whole reason why you came to me. So why do I want to see you that many times when I know you don't need it? So that's my biggest thing. I even have friends that I have down in West Palm, and anytime they hurt themselves, they text me, and I'm like, okay, let me look it up, and I'll look up chiropractors in the area, and I'm like, okay, this one, no, this one, no, this one, no, this one, maybe, and then I'll send them there. They go, they come back to me, and they're like, okay, they want me to do this, and I'm like, no, that's not good. Go to somebody else. It's just so hard to find a good chiropractor that wants to get you better and doesn't want to just drain your pockets.
Sure.
And that's where I structured my entire business model around, is that I want to get you better. I don't look at the money side of anything, at all. Even at the beginning of practicing, I tried to take myself out of it and just say, look, I don't even care how much it takes. I'm going to get you better. And, at the beginning, it kind of sucked because I was really slow, but I got patients better.
Sure.
And then now it's picking up because why? Because I'm getting them better.
Yeah. And that's what people want, right?
Exactly.
That's why they're there.
Exactly.
Sometimes you lose sight of that. I think you're told to go to the doctor, go do these things, and you have to, versus when you go to buy something, right? You buy the TV because you want to sit around and watch the game, right? When you go to these places because you want to get better and be able to play with your grandkids and go golf and all that kind of stuff. So you got to keep that goal in mind at the end of the day. And the goal is not to become a professional, go to these offices, right?
Exactly.
It's to figure out what we need to take care of our body long term.
Exactly. No, 100%.
Do you have any other fun tidbits for us, Brittney?
I mean, just stay active. You know how important that is.
Absolutely.
And we work hand in hand with what we do. I mean, there's many things that I can't do inside my office that I have to send to you for, because that's what your specialty is. And that's the thing, is you need to know your scope of practice.
Absolutely.
I know what I can and cannot do. Once I get somebody that stabilization process, I can give them a little bit here and there, but if they need more, they need to go get something from someone else.
Sure.
That's the thing, is know your scope of practice.
Yeah. And we work really well together, right?
Yeah.
Because there are people who really do. They need what you do, and it's a great way to hey, she knows what she's doing.
Yep.
First of all, spine, there's a whole lot of stuff that run through there.
Oh, yeah.
And a lot of times if you get adjusted and manipulated, right, you feel better in general. It's a nervous system reset.
Exactly.
Even more so than a putting stuff back in place, maybe
Exactly,
the
yep.
simplest way, and tell people that is an awesome time to now go, hey, this thing was hurting for so long, let's break that cycle.
Exactly.
And then go load it, because you're going to
Yeah.
feel a lot better, and better yet, you're going to move better, right?
Exactly.
You can load in good
Feel better,
positions.
move better.
Yeah, and we need that help to get there, right?
Exactly,
So
that's
that's
the
where
thing.
you come into play.
Like the little jump start to get you back up where you
Yes,
need to be.
jump start.
Mm-hmm.
I love that.
Yeah, it all goes. It all plays together. Everything goes back to a car. You know what I mean?
Yeah.
You got to jump start your car sometimes. Sometimes your body needs it too.
I love that analogy.
Yeah.
It's easy to comprehend.
It is, and that's the thing. You got to be able to break it down to where other people can understand it, because
Sure.
I could come in here and talk all scientifically to you all day long and you would get it, but all these people watching,
Yeah.
you're going to have a million comments like, never allow her back again.
And I think you even see that trend with chiropractic physical therapy, where we have this really cool thing where we can operate just on the outskirts of like traditional medicine.
Yep.
And we can focus on like, hey, we're going to tell you what's going on. It doesn't have to be complicated.
Exactly.
It really doesn't.
Exactly.
You just know when the complicated stuff sometimes just makes it a little harder.
Yeah, no,
So-
it definitely does. The more the patient understands about what's going on with their body, the
Yeah.
more likely they are to feel better
Absolutely.
and stick to the plan.
Buy in.
Yep,
Yeah.
exactly. So like if you can break it down, like I have a little model of a disc herniation. It's a perfect like 2 vertebrae and a little sponge in between, right? And I use that model so many times that I'm pretty sure I got to buy like 6 more.
Yep.
Because I'm running around to each room trying to find it whenever I have a patient come in that has a disc injury, because I want them to see what's going on.
Sure.
Like if they know what's going on, they're more likely to get better.
Absolutely.
And so there's been many a times, like I always use the analogy of, I explain what I'm doing and why I'm doing it when I'm adjusting, because I hate going into a doctor's office and not knowing what they're doing and why they're doing it.
Sure.
Like how many times have you gone to the doctor's office and they just start drawing blood? Why are you drawing blood? What are you looking for? Don't you need a reason to do what you're doing?
Sure.
Oh, it's just, we do it on every patient. Why? You know, like, but what are you looking for?
Sure.
And the same thing is when you take your dog to the vet. You go in there and you'll walk out with a $700 bill and don't even know what happened.
Mm-hmm.
They gave your dog a treat. Next thing you know, you're paying $800. Like it's insane. So tell me what you're doing.
Sure.
Tell me why you're doing it and tell me what you're looking for. So that's exactly what I do when a patient comes into my office. I walk them through the entire adjustment. I don't care if they've been to chiropractors every single day since they were born. I want you to know what I'm doing and why.
Absolutely.
And so I walk them through it. And then after that, I'm like, okay, you should feel better. And if you don't, let's bring you back in. Let's get this assessed. Let's figure out what's worked best for your body, because every spine is different.
Yep.
So the way you respond isn't how I respond, isn't how Joe down the street responds. So figure out how you respond and treat that way.
Yeah. You got it. You got to see what's in front of you.
Exactly.
Make it as simple as
And
possible.
go for it.
Yeah. Brittney, how can we find you? Where you at?
So I am at Riverside Chiropractic. It's located here in Vero Beach. We are right down the road from you now.
Yep.
We used to be next door, but we just moved to a bigger location because we're growing so exponentially. That's awesome.
Yes.
Which I can't wait for you to come see it.
Yes, I'll be over there hopefully in the next couple of days.
Yeah, we actually just moved yesterday, so we're still trying to work out the kinks. You know, ran into a little road bumps here and there, but we're getting there.
You guys are seeing patients there,
Yes,
correct?
yes.
Okay.
Started yesterday, which was rough, but we did it.
Okay.
We made it through. I also learned that there's a long way around and then a short way, and I always ended up taking the long way, so I hit all my steps by noon, which was good, but like, what the heck? But yeah, so I'm at Riverside Chiropractic. It's down the road. The building number is 777 37th Street. You can reach out to me on Facebook, on Instagram, anything like that. Look up the office, call the office line. I'll be glad to talk to you.
I'll throw all your info in the show notes, so anyone who
Perfect.
needs you will find it and just click that link in the bottom.
See,
I think
he
that's
knows all the
easiest.
stuff.
We know what's easier. It's just click that link.
Ain't that true?
Yes.
If it's not clickable, it's worthless.
Exactly. Brittney, it was awesome talking to you.
It was a pleasure.
And go see her.
Yeah, thank you.
Yeah.